With any surgery, the risks are pain, bleeding, infection. Thankfully, bleeding and infection tend to be minimal with the surgery. We also have a lot of good methods for pain control. Specifically with palate surgery, the main things we worry about are one, a fistula, which means a connection between the mouth and the nose if there are any problems healing. Our rates of that have gone down significantly with improved techniques, but that is always a risk, especially if there's any sort of infection afterwards. The other main risk is that even when we move the muscle to the back and repair the palate, especially for patients who have low tone or inherent problems with the nerves, even with everything in position, sometimes the palate just doesn't work the way we need it to. So in those cases, you have to do another surgery to either lengthen the palate or some other way to close down the space in the back of the throat between the palate, between the nose and the mouth.